once again. We had a little bit of technical difficulties, so we're back. Dr. Larry Kidd here, Dr. Bud Lawrence. You guys recognize us. We're here frequently, weekly. And today we're going to be addressing a few questions, as well as one of our focuses is on the fact that things are starting to reopen. As you're starting to see with the number of states, there have been businesses that have reopened, various services, etc. And the same is true with healthcare. And our hospital specifically, this week we're preparing or have prepared, and next week we'll be opening a number of those services that have either have been reduced in terms of the business and service they provide, or have been closed altogether. One such is our outpatient surgery center, which will be fully open for business. We'll be doing all of those type of procedures that we were engaged with before the COVID-19 restrictions kicked in. What you'll notice at our hospital is we have all of the precautions in place in terms of hand hygiene, dispensaries. We will have the spacing of patients in terms of their appointments, so there's appropriate distances, that sort of thing. And one thing to emphasize, as you in the community start to have the opportunity to go to places, public places where the community is allowing for some small gathering at businesses and that sort of thing, do keep in mind the most important thing is to continue to practice social distancing, good hand washing techniques. Those are the things that will really continue to be our best defense against spreading the virus. I've had a few inquiries about different states opening up beaches, businesses, not such the case in California quite yet, but eventually we're going to get there. And the inquiry has been whether or not that has been an issue for those states, say last week, that started to open up those kinds of public areas. The truth of the matter is we don't quite know yet. It could be a couple of weeks before we know those areas that opened up last week, whether or not they're going to have issues in terms of virus spread, because it can be a few weeks before folks actually come down with symptoms, that sort of thing, as before. So the best practice is to continue to behave in such a way that you could be in contact with individuals, but you just don't know. So those good practices will be very important.
Yeah, it's a really good point, Dr. Kidd. I think that when you look at these other states that are opening things up, as he said, as Dr. Kidd said, we probably won't know for about a week and a half to 3 weeks after they open how successful that reopening is. And we also have to take it with a bit of a grain of salt that those states are not exactly set up exactly how our state is in terms of population density and other factors. So just like we are not in the same boat as New York because of these various factors, we're also not in the same boat as Georgia. Georgia opening back up will be very telling. I'm very interested to see how that goes. However, it's not a one-to-one correlation. I think you have to just be very cautious. I know that there are a lot of smart people working on trying to get us open as quickly as possible. And to that end, the CDC, this whole time we've been talking about recommendations and things we're doing, everything is very, very labile. It all changes from day to day, always evolving. So also evolving is the previous recommendation. If you had a positive COVID-19 test or you were suspected of having COVID-19, the recommendation was 7 days of quarantine and 3 days of no fever and improving symptoms. Well, they just changed that, and they've updated that to now 10 days of home quarantine. So it's an additional 3 more days of home quarantine, along with 3 days of not having any fever and improving symptoms, meaning that if you had a cough, your cough doesn't go away completely, but is getting better. So that's a very interesting change by the CDC. I think part of it might be due to the fact that they think that there's a longer period of time that perhaps virus is shedding from people. We don't know if that's really correlated yet with being infectious. but I really think in my heart of hearts the reason why they might have made that move is because if we're opening up different states and you're relaxing those requirements, it makes sense to me to tighten up the requirements a little bit on the patients who are positive. So that is, I think, maybe a little bit related to this move of allowing all the states to help move in the direction of opening things up. If you put a little bit of a tighter restriction on patients who are positive or suspected of being positive, that helps protect the greater community in this time of change as we move to get businesses open and get our communities back to where we were before, or as close as we can be.
Right, very good points that Dr. Lawrence makes in that as we start to reopen, we're learning of ways that we might do it in a safer way, so the CDC guidelines might be adjusted, as well as we're learning new information about the behavior of the virus, such as new symptoms that have shown up in some populations that have tested positive that seem to be common that we didn't really recognize before. We've had a couple of questions about how is it going at the hospital in terms of numbers of COVID patients and how they're doing, that sort of thing. And as reported on Wednesday, we continue to see a number of patients that are being discharged from the hospital. They are improving, and we're seeing fewer patients that are sick enough that they have to be admitted for COVID. What we also, again, continue to encourage our community is for all those other things that could bring you to a hospital, we need you to not delay in terms of emergency care. So over the next few days, as we start to open up, we would like to see patients come and receive the care that they have delayed, because across the country, there have been reports of people actually becoming very ill and their survival not being as great when they don't come in timely enough to get the care that they need.
I cannot echo that enough. Our ER volumes, our emergency department is seeing less than, or if you cut our volume in half, we're seeing even less than that. So more than almost 60% less volume than we would usually see this time of year, which I get it, people are trying to stay at home, but it really is concerning. Dr. Kidd's talked about how this is a national trend. It really is, but we are seeing this locally in our community, patients coming in late in their presentation. Remember, almost all that we do in the emergency department is very time sensitive. It's an emergency department. We deal with time sensitive items. So right now, if people are at home thinking, you know, I don't really want to go in there, I don't want to get sick with COVID, and they put off their time sensitive issue, that really concerns me, and it makes me very sad to think that patients would choose not coming in, you know, based on their fear. Please come in. Our patients are wearing masks. We have our department clean, and it's segregated such that COVID patients are in one place, suspected COVID patients as well, and then our clean areas where we can take care of all the things you may need for your belly pain, nausea and vomiting, fever of other issue, chest pain, stroke stuff, cuts, knee pain, whatever it is. We're here for you. We don't want to have you put something off and then have to have a longer course of healing to make up for that. It doesn't really make sense. Please keep that in the back of your mind.
Right. And just to dovetail on that, you haven't heard us talk much about PPE lately. We at the hospital are prepared as well in terms of folks returning for the various procedures and so forth that they may have delayed. We have the equipment, the PPE that's required. The sanitation is top-notch here. So again, this is a very safe, clean place to return for your care needs.
Absolutely. One question that did come up, I want to address a question, and it says, will you be treating patients with remdesivir now that it's been shown to improve outcomes? So just recently, very, very recently, remdesivir, which is a medication that is made by company Gilead, which is probably what you've heard on the news, got an emergency use authorization from the FDA. We've talked about emergency use authorizations, EUAs, with testing kits and certain types of tests. Well, they also do it for medications, and this just got approved. So Absolutely, we talk about using all these medications that we have at our disposal, or that we can get to help our sickest COVID-19 patients, including things like convalescent plasma. We are working on all those items to make sure that we're able to offer all of our patients whatever they may need in their time of need. We should also say, though, that there, as Dr. Kidd brought up, there has been less and less very sick COVID-19 patients. So we are really seeing that it is a plateau. It's definitely not a peak. We're at a plateau, but I am seeing that plateau steadily sort of drift downwards. Now, it'll be very interesting to see once the state opens everything up, if we see any bumps in that. And we, again, talked about other states that are opening things up before us, so we'll have a little bit of telltale information. But that, I'm very hopeful that when we open things up, that plateau will continue to decrease, and it will kind of just be a really slow, steady burn, not overwhelming the healthcare system, and hopefully no patients dying or getting worse or much sicker.
Right, very much so. As we look to the future in terms of things starting to open up, we will be transitioning next week our Facebook Live. We will come to you on Wednesdays. We will provide updates in terms of those things related to opening up. How are things going at the hospital in terms of the new services that we've started? And so, again, we'll continue to provide updates related to COVID-19. A lot of information is out there being tested, new treatment modalities, that sort of thing. So we'll be bringing some focus to you in that regard as well. We thank you for having tuned in over the last so many weeks, and that we've appreciated the support from the community. I'd like to acknowledge the amazing team of healthcare clinical professionals here, all of our support teams, our housekeeping staff, our engineering team, our food service workers. It's just been an amazing team effort here to take care of patients, not only with COVID, but those that are coming in for other needs as well. So thank you so much for tuning in. We will next week be with you on Wednesday at this time, and we hope that you will stay tuned, and we look forward to being with you again soon.
Stay healthy, stay safe, and thank you for tuning in. Have a great weekend.
Okay, take care.